Hi, this is Unlimited Access. My name is Levi. I'm with Shannon Ellsworth, CEO and founder of My Health Hatch. There is this looming crisis around the world, a shortage of doctors and nurses. You and I scrolled through the internet. We found article after article after article. It's limitless in what's out there about it. What does this mean for the medical industry?
It's a difficult problem going on right now. There is a huge shortage in all groups. You can look up providers, doctors, nurses, ERs. You see, entire ERs leaving because they're burned out. And that's probably the number one problem right now that is creating is burnout. And burnout puts more pressure. If you think about it like layoffs in a company, it puts more pressure on the existing people to do more than they're already doing. COVID kind of exposed all of this shortage anyways. It was looming anyways, but then all of a sudden, COVID just put an added pressure and you started to see people just break. They're leaving the industry. You have providers, primary cares who have retired because they're like, I can't do it. And on top of the administrative work that they have to do, the challenge with the records, the challenge with digital health and pushing digital health out to a consumer base that may or may not be ready for it. It's a really big struggle. I would say the biggest challenge it's going to pose for the industry is there's going to be a bigger opportunity for mistakes. You're going to lose more people, a bigger opportunity for just losing more people, and patients are going to get worse care, not intentionally, but they're really going to struggle. Getting a primary care, getting a new primary care right now, you actually can't do it because there isn't the availability. So when everybody talks about increasing access to care, it's going to be really hard. So you see telehealth popping up because even getting access to a primary care doctor right now is almost impossible. It's just a domino effect that they're struggling, the medical community is struggling, which puts pressure on the patients being able to find care. And then it increases the risk across the board, not only for mistakes, but risks on the doctors and the nurses who are trying to make good calls with good information, and they just don't have it.
So what does that mean for the caregiver? The shortage of primary care doctors, what does it mean for the caregiver?
It means there's going to be more requirement of the caregiver to get involved if they're not already involved, or to make decisions that they're not prepared to make. I just had a conversation with a friend the other day whose parents both ended up needing full-time care, and there's no place to put them. There's no place for them to engage. There's no place for them to really reach out to, and they don't understand what their resources are. So kind of like I was a deer in headlights, there's a lot of caregivers who are like all of a sudden responsible because what normally used to be the provider's responsibility of admin work is now being asked of the patient, and the patient can't do it because they're sick, they don't feel well. It's hard to look at your own situation objectively. So the caregiver's responsibility is to really help manage that care, that time between provider visits and the patient being at home and being well. So it really puts a lot of pressure for the caregiver to take on more and more of that day-to-day management of the care. And I don't mean doing the care like a medical professional would, but helping manage the patient like a nurse normally would, because there's just nobody there to be able to take care of them.
So what advice do you have?
I'd say look at My Health Hatch. That's what we're doing. It's something that, I lived with wishing I had this. And as a technologist, from a career perspective, I looked around to find a platform like this. There's lots of digital health platforms out there. There's lots of caregiver platforms, really understanding what those caregiver platforms can do for you. But the big thing that we're trying to address is the administrative side, so that you can focus on, helping the patient do what they need to do to get better. And that's one of the things I wrote in one of my blogs the other day, was really allowing the patient and the doctor to do what they do best. The patient does the work. The doctor tells the patient, hey, here's how you got to get better. The caregiver should grab some digital health apps like My Health Hatch to organize and offload some of this day to day. So that's not what they're spending all their time. I spent 6 hours last week, as you know, doing a record search for my dad. And that was 6 hours I could have spent with him doing exercises so he could walk and not fall again. So really getting, as a caregiver, getting things, tools like My Health Hatch that will help you organize and get to the side of being healthy.
All right, good. Well, that's it for today's episode. My Health Hatch is all about making easy access for your medical records, having everything in one place. We believe people make better health decisions when their medical information is easy to understand and get access to. We put all your records, data, appointments, and education all in one app. Thank you so much. Bye.
Thank you.